Dr. Mark Fesler. I'm a hematologist oncologist at St. Luke's Center for Cancer Care. I tend to specialize in blood cancers. So the main blood cancers that I see patients for, and I see adult patients, not pediatric patients, would be leukemias, lymphomas, multiple myeloma, and then myelodysplastic and myeloproliferative disorders. So those are the main categories of diseases that fall into blood cancer. The blood cancer field's rapidly evolving, both in terms of how we diagnose blood cancers and how we treat blood cancers. So the diagnostic tools that we have are increasingly improving to detect disease at a very low level, primarily in the blood, but also in the tissue. The way that we treat blood cancer continues to evolve and improve. So we used to use just chemotherapy and radiation, but now we've got a whole battery of additional treatments that attack the cancer cells more specifically. They might target specific mutations within the cancer cells, and then also the broad field of immunotherapies moving into the cancer field increasingly as well. Immunotherapy is basically any treatment that stimulates a patient's own immune system to help attack the cancer. Typically it's done as an IV infusion format, but immunotherapies, there's some oral treatments as well available from an immunotherapy perspective. Clinical trials are the way that we move the field forward in oncology. Patient enrollment on clinical trials is important to advance the field, and patients sometimes can receive therapies they wouldn't otherwise receive as part of standard treatment on a clinical trial. The immune therapies that I'm excited about are something called bispecific antibodies. These are antibodies that bring the cancer cell in close proximity to the immune system, and I'm planning on offering immunotherapy with bispecific trials here at St. Luke's to try to help patients in their cancer journey. These bispecific antibody trials could be for lymphoma, they could be for leukemia, they could be for myeloma. And specifically, they might offset the need for chemotherapy, both in terms of frontline treatment, but then also potentially help the disease when there's no other treatment options that exist when the disease has come back or been relapsed or refractory.